Divya 20 for subscription on Auricle. So these are some of the short question and answers which we'll be dealing today. So before we start the classes, let us look at what is this exam mastery live classes. So this we started since June 5th and it's for a duration of about 30 days. So here we are doing rapid revision of all the important questions and quick revision of all the volatile facts, as well as we are covering all the yielding topics of all the subjects. So here the most expected questions in the university exams are covered. So this is beneficial for all the universities of all the states. You can use the code Dr. Divya 20 for the first free live class. Some of the core features of Auricle include live classes, and we have recorded classes which you can access the subjects at any time, anywhere. And we also offer you notes which are based on CBME curriculum and MCQs also. It comprises of the MCQs where you can do your self-assessment, and the MCQs range from beginner level to expert level, and they're all standard multiple choice questions which are commonly asked in the exams. So subscription plans, the basic, standard and mentorship program. Mentorship is a wholesome program which we give you, which we are offering at a special rate of 50,000. So here it includes the services which we offer in basic and standard, as well as there is one-to-one personalized guidance, and we also give you the notes. You can use the code for the discount on subscription, Divya 20 on discount on subscription. You can as well book a slot for personalized counseling session too. So we'll start with today's class. So the first question, explain about the anatomy of oral cavity. So first we define what do we mean by oral cavity. So it is used for ingestion of food and fluids. So it is continued posteriorly, the oral cavity, it continues posteriorly into the oropharynx, that is the middle part of the muscular pharynx. The upper part of it consists of the posterior part of the nasal cavity, that is of the pharynx. Upper part is the posterior, which we call it as the nasopharynx, and lower part consists of the inlet of larynx, which we call it as the laryngopharynx. Okay, the lower part of this oral cavity. Here, the roof of this oral cavity is formed by the hard and soft palates. So the oral or the mouth cavity is divided into an outer small portion, which is called the vestibule, and the inner larger part, which is called as the oral cavity proper. So vestibule of the mouth. So what is that? It is the narrow space bounded externally by the lips, okay? Externally by the lips and the cheeks, and internally by the teeth and gums. So it communicates to the exterior through the oral fissure and with the oral cavity proper, freely with the oral cavity proper. Then it also communicates that the communication here, the parotid duct opens, okay, into the oral cavity. So where does it open? On the inner surface of the cheek, that is in the vestibule, opposite the crown of the upper second molar tooth. And there are also many labial and buccal glands, which are mucosal glands, which are situated in the submucosa of the lips and cheeks. They also open into the vestibule. And 4 or 5 molar glands situated on the buccopharyngeal fascia also open into the, so all these glands you can see, they open into the oral cavity. So the entire vestibule is lined by mucous membrane, okay? And the mucous membrane forms the median folds from lips to gums called the frenulum of the lips. Okay, so here. So the lips, they are the fleshy folds which are lined externally by the skin and internally by the mucous membrane. The mucocutaneous junction lines the edges of the lip. Part of the mucosal surface is also normally seen. Okay, so mucocutaneous junction, which I would also call it as the transition zone or the vermilion zone. Okay, so that is what we are saying about. So each lip, okay, so lip will, what is the structure of the lip? So it has the skin, superficial fascia. Beneath that, there is the muscle, that is orbicularis oris muscle. The submucosa, which contains the mucosa labial glands as well as blood vessels and the mucous membrane. The oral fissure, it meets the lateral angles of the mouth. The inner surface of each lip is supported by a frenulum, which ties it to the gums. Okay, so when we pull the lip and see, we can see that. Okay, the inner surface where there is a frenulum, that is the mucosal fold. Philtrum is this. This is the philtrum portion, which is a medial vertical groove on the outer surface of the upper lip. So lymphatics here, the central portion of the lower lip, okay, central portion of the lower lip, it drains into the submental lymph nodes, whereas the rest of the lower lip, it drains into the submandibular group of lymph nodes. Then cheeks or the buccal. So here they are the fleshy flaps forming the larger part of the side of the face. They are continuous in front with the lips and the junction is indicated by the nasolabial sulcus. Okay, so here. So it extends from the side of the nose. Okay, so from the side of the nose to the angle of the mouth. Okay, here. So that is the nasolabial sulcus or the furrow. So each cheek will have like skin, superficial fascia containing the facial muscles. Parotid duct is present within, and molar glands as well as vessels and nerves. Then there is buccinator muscle, which is covered by the buccopharyngeal fascia, and which is pierced by the parotid duct. Then below that, we see the submucosa with mucosa, buccal glands, mucous membrane, buccal pad of fat, which is well developed in infants, we see it a lot, buccal pad of fat. Okay, so it lies on the buccinator, deep to the masseter, and partly in front of it. So the lymphatics, basically, they drain into the submandibular and the preauricular group of lymph nodes, and buccal as well as mandibular group of lymph nodes. The next portion, that is the oral cavity proper, anterolaterally, it has the teeth, the gums, the alveolar arches of the jaw. Roof is formed by the hard palate and the soft palate. Floor is occupied by the tongue, okay, and sublingual region, okay, posterior there is tongue and sublingual region anteriorly. Posteriorly, it communicates with the pharynx, okay, through the oropharyngeal isthmus. Superiorly, there is soft palate, and inferiorly, that is the dorsal part of the tongue, okay. And on each side, there are the palatoglossal arches. So this is what soft palate here we see, the dorsal part. These are the palatoglossal arches. Then the sublingual region, okay. So sublingual is below the tongue, okay. So here there is a median plane, a fold of mucosa passing from the inferior aspect of the tongue to the floor of the mouth, okay. So there is a fold that is called here, you can see, this is the frenulum, okay. So on each side of the frenulum, okay, on either side of the frenulum, you can see the sublingual papillae, where the sublingual glands open. And on the summit of this papillae, there is opening of the submandibular duct also. Laterally and backwards from the sublingual papillae, there is the sublingual fold overlying the sublingual gland. Lymphatics, anterior part of the floor of the mouth, okay, anterior part here, it drains into the submental group of lymph nodes, whereas the hard palate and the soft palate, they drain into the retropharyngeal and upper deep cervical lymph nodes. The gums and the rest of the floor, okay, they drain into the submandibular group of lymph nodes. The gums are the gingivae. So here, the soft tissues, they are the soft tissues which envelop the alveolar process of upper and lower jaws. So it is mainly composed of dense fibrous tissue, which is covered by stratified squamous epithelium. And each gum now has two parts. So the free part surrounds the neck of the tooth, and it has an attached part which is firmly fixed in the alveolar arch of the jaw. Okay. So teeth. The teeth, they form the part of the masticatory apparatus and are fixed to the jaw. Teeth of the first set are known as milk teeth or deciduous teeth. Okay. And the second set which appears, we call them as the permanent teeth. So deciduous teeth, they are about 20 in number. And in each half of the jaw, that is upper and lower, no? If you take each half, there are two incisors, one canine and two molars. The permanent teeth are about 32 in number, and it consists of 2 incisors, 1 canine and 2 premolars and 3 molars in each half of the jaw. Okay, so permanent teeth are 32, whereas deciduous teeth, they are about 20 in number. Then each tooth has got 3 parts. Okay, so it has a crown, it has a root and a neck. So the crown portion is the projecting, which is projects above or below the gum. Okay, projecting above or below the gum. So that is when we consider the upper jaw and the lower jaw. Okay, the lower jaw we say above, and here we say below. So the root, it is embedded in the jaw beneath the gum. Okay, so it is the embedded portion of the jaw. So the neck portion comes between the crown and the root, and it is surrounded by the gum. So structurally, each tooth is composed of, okay, so if you see here, there is the pulp in the center. Okay, this is the pulp portion, which is present in the center. Then the dentine, excuse me. So the dentine portion surrounds the pulp. Then the enamel, this is the hardest substance, okay, enamel. So it is the most in radiology, it will be the most radiopaque substance when we take an X-ray of the head and neck region. So here, the enamel covering the projecting part, this is the enamel, okay? And the cementum here will be this portion which is surrounding the embedded part of the dentine. And there is the periodontal membrane, okay? Periodontal membrane will be around the tooth. Then the pulp, here it is, what is this pulp? The pulp is loose fibrous tissue which contains vessels, nerves and lymphatics. The pulp is covered, okay? So the pulp, it is covered by a layer of tall columnar cells known as odontoblasts, okay? Odontoblasts. And dentine, above that, it is a calcified material containing spiral tubules radiating from the pulp cavity. So each tubule is occupied by a protoplasmic process from one of these odontoblasts. Okay, so odontoblasts are those columnar cells. So calcium and organic matter are in the same proportion as in the bone. So enamel here is the hardest substance made up of crystalline prisms lying at surface of the tooth. Cementum, the cementum, there is here, okay, cementum, there is no blood supply or nerve supply there in the cementum. Over the neck, the cementum commonly overlaps the cervical end of the enamel. Periodontal membrane, it acts as the periosteum to both the cementum as well as the bony socket. Okay, so the form and function. Okay, so the incisors, they are responsible for, they are like, the cutting teeth. Okay, so they are chisel-like crowns. The canines are holding and tearing teeth with conical and rugged crowns. Each premolar has 2 cusps called the bicuspid tooth. Okay, each premolar. Molars are grinding teeth with square crowns bearing 4 or 5 cusps on their crowns. So incisors, canines and premolars have single roots with the exception of the upper first premolar which has a bifid root. Okay, upper molars have 3 roots, that is 2 lateral and 1 medial, whereas the lower molars have 2 roots, that is 2 roots, 1 anterior and posterior. So the eruption of the teeth. So when do the teeth erupt? The first teeth, that is the deciduous or the milk teeth, it begins to erupt at about 6 months. Okay, and all the teeth are erupted by the end of 2nd year or soon after. So teeth of the lower jaw, they erupt slightly earlier than the upper jaw. So blood supply of the teeth, both upper and lower jaw, is by the branches of maxillary artery. Okay, that is through the inferior alveolar and from the first part as well as from the posterior superior alveolar from the third part. Okay, so they supply. Then nerve supply of the teeth. Nerve supply, upper teeth, it is by the posterior superior alveolar, middle superior alveolar, and anterior superior alveolar nerves, which are coming from the maxillary. Okay, that is through the pterygopalatine ganglion. It gives the branches, okay, in the pterygopalatine fossa. Then the hard palate. Hard palate, it is a partition between the nasal and oral cavities. Okay, so this is the hard palate. So anterior 2/3 of it is formed by the palatine process of the maxilla, and posterior 1/3 of it is formed by the horizontal plates of the palatine bone. So the anterolateral margins, okay, so they are continuous with the alveolar arches and gums. Posterior margin there, it is unossified, and then it forms the soft palate. The superior surface is the floor of the nasal cavity, and inferior surface is related to the oral cavity. So arteries here are the greater palatine branch of maxillary artery. Veins, they drain into the pterygoid venous plexus. Then the nerves, okay, supplied by the greater palatine and nasopalatine branch of pterygopalatine ganglion, okay, which is through the maxillary nerve. Lymphatics, upper deep cervical group of lymph nodes, and partly it also goes to the retropharyngeal group of lymph nodes. Okay, next is soft palate. Okay, soft palate is a very commonly asked question. So it is a movable muscular fold suspended from the posterior border of the hard palate. So whenever anything is asked, first we should define what is it. First we should tell about it. Okay, movable muscular fold, it is suspended from the posterior border of the hard palate. So what does it do? It separates the nasopharynx from the oropharynx. Okay, so this is it basically it's like crossroad there where for the food and the air. Okay, so air comes through the nasopharynx, okay, and food through the oropharynx, right? So soft palate has two surfaces, anterior and posterior, and two borders, superior and inferior. So anterior or the oral surface has a median raphe. The posterior surface, it forms the floor of the nasal cavity. The superior border is attached to the hard palate, okay, and blends on each side with the pharynx. The inferior border forms a part of the pharyngeal isthmus. And from the middle of that inferior border, there will be a conical projection which hangs. When we open the mouth, we can see it, right? And that is called as the uvula. So from each side of the base of the uvula, two folds, okay, two curved folds. If you see here, this is the uvula, and two curved folds of the mucous membrane. They extend laterally and downwards. Okay, so two folds. So one fold is coming from, that is in front here to the tongue region, that is known as the palatoglossal. Okay, anterior fold is called as the palatoglossal fold or the arch. And and each of these fold, they are nothing but the mucosal fold covering the similar muscle, okay, similar named muscle. That is palatoglossal muscle, which is covered by the mucous membrane, okay. So this arch, it reaches the side of the tongue at the junction of its oral and pharyngeal parts, that is anterior 2/3 and posterior 1/3 part, okay. And posterior fold is called as the palatopharyngeal arch or the posterior pillar of the process, which contains the palatopharyngeus muscle. So this forms the posterior boundary. So basically between these two folds, okay, the palatoglossal and the palatopharyngeal fold, it encloses a fossa that is known as the tonsillar fossa. And the posterior fold, it will merge inferiorly with the lateral wall of the, as the name says, is the palatopharyngeal fold consisting of the palatopharyngeus muscle. So it will merge inferiorly with the lateral wall of the pharynx. So soft palate is a fold of mucous membrane containing the following parts. That is, one is palatine aponeurosis. Okay, so what is this palatine aponeurosis? It is the flattering tendon of tensor velli palatini muscle. Okay, so the tensor velli palatini muscle, it forms the fibrous basis of this, it forms this palatine aponeurosis. Okay, and this aponeurosis will split to enclose the musculus uvulae muscle. The levator villi palatini and the palatopharyngeus lie in the superior surface of the palatine aponeurosis. And palatoglossus, it lies on the inferior or anterior surface of the palatine aponeurosis. Numerous mucosal glands and some taste buds are also present there. And the muscles, they are derived from the first, fourth, and sixth branchial arches, and so are innervated by the mandibular and vagoaccessory complex. What do we mean by vagoaccessory complexes? The cranial part of the accessory nerve will join the vagus and supply through the vagus. Okay, so that is why it is called as vagoaccessory complex. So muscles of the soft palate, which are the muscles? We have tensor veli palati muscle, levator veli palati muscle, musculus uvulae, and the palatoglossus muscle. Okay, so this is levator veli, tensor veli palati muscle. Then we have the palatopharyngeus muscle and palatoglossus muscle. So the motor nerves here. So all the muscles of the soft palate, except for tensor veli palati, are supplied by the pharyngeal plexus. So pharyngeal plexus are basically formed by the vagus nerve, the glossopharyngeal, as well as the sympathetic nerves from the superior cervical ganglia. Okay. So the fibers of this plexus are derived from the ear. So the cranial part of the, as I said, it's contributed by the vagus too. So tensor veli palati. Tensor veli palati is derived from the first branchial arch. So that is why it's supplied by the mandibular nerve. Okay. So tensor veli palati, no, that is a nerve of the pterygoid. Nerve of pterygoid, that is medial pterygoid, which arises from the trunk of the mandibular nerve that supplies this muscle too. That is the tensor veli palati muscle. The general sensory nerves, they are derived from middle and posterior lesser palatine nerves. So branches of the maxillary nerve, okay, they are the branches of the maxillary nerve through the pterygopalatine ganglia and glossopharyngeal nerve. That is the posterior part through the glossopharyngeal. Special sensations, that is taste sensations from the oral surface by the lesser palatine nerves fibers, they travel through the, so we are talking about the palate here, okay, not the tongue. So mind you, so the taste sensations from the oral surface of the soft palate we are talking, they are carried by the lesser palatine nerves and they go through this greater petrosal nerve to the geniculate ganglion of the facial nerve and then from there to the nucleus tractus solitarius. The secretomotor nerves, they are the lesser palatine nerves derived from the superior salivatory nucleus and travel to the greater petrosal nerve. Then movements and functions of the soft palate. So palate controls two gates, that is the upper airway and as well as the pharyngeal isthmus. Okay. That is upper airway, which we call it as the otherwise pharyngeal isthmus, and the upper footway or the oropharyngeal isthmus. So the upper airway crosses the upper footway. Okay. So because air passes and it has to come to the larynx in front, whereas food passes and it crosses to the pharynx behind. Okay. So it crisscrosses there. So soft palate plays an important role in chewing, swallowing, speech, coughing, and sneezing. The other specific roles include it isolates the mouth from the oropharynx during chewing so that the breathing is unaffected. Okay. And it separates the oropharynx from the nasopharynx by locking passivens ridge during the second stage of swallowing. So passivens ridge is formed by a few of the fibers which form a U-shaped sling, okay, near the pharyngeal isthmus. That is the fibers of palatopharyngeus muscle. So that time it tenses that, it contracts, that muscle contracts and it will prevent the food from entering the nasopharynx. So by varying degree of closure of the pharyngeal isthmus, the quality of voice is also can be modified and various consonants are correctly pronounced. During sneezing, the blast of air is approximately divided and directed through the nasal as well as oral cavities without damaging the narrow nose. Okay. Similarly, during coughing, it directs the air and sputum into the mouth. So that is its special functions. So blood supply. Arteries include greater palatine branch of maxillary artery, ascending palatine branch of facial artery, and palatine branch of ascending pharyngeal artery. Veins basically drains into the pterygoid and tonsillar plexus of veins. Lymphatics, it drains into the upper deep cervical and retropharyngeal group of lymph nodes. We're coming to passivance ridge. So some of the upper fibers of the palatopharyngeus muscle, they pass circularly deep to the mucous membrane of the pharynx and forms a sphincter internal to the superior constrictor. So the fibers constitute the passivance muscle on, so these muscle fibers, we call them as the passivance muscle. Okay. So this when they contract, what happens is it raises a ridge called as the passivance ridge on the posterior wall of the nasopharynx. When the soft palate is elevated, it comes in contact with this ridge, and together they will close the pharyngeal isthmus between the nasopharynx and the oropharynx. Okay, so we will see it here, passivance ridge. Okay. This is the soft palate, this is the passivance ridge. So morphology of this palatopharyngeus muscle. So epiglottis. Okay. So the epiglottis, it lies above the level of the soft palate, which is supported by two vertical muscles, the stylopharyngeus and salpingopharyngeus. Okay, we are talking about the palatopharyngeus. Okay. So this is supported by two vertical muscles, the stylopharyngeus and the salpingopharyngeus, and by a sphincter formed by the palatopharyngeus. Okay, that is the palatopharyngeal sphincter. It clasps the inlet of the larynx. Some fibers of the sphincter, they are left behind and form a sphincter inner to the superior constrictor, which we already said, no? See, usually the muscle is going longitudinally downwards because palatopharyngeus is an intrinsic muscle of the pharynx. Whereas some of the fibers, they go all around, they form a sphincter. Okay. Like a U-shaped sling they form, where they form the passivance ridge. Okay, next coming to the pharynx. Pharynx is a funnel-shaped fibromuscular tube extending from the base of the skull to the esophagus. So boundaries. Okay, so boundaries, it has superiorly, it is the base of the skull. Inferior, it is the lower border of the cricoid cartilage. Okay. So inferiorly, it lies at the level of the lower border of the cricoid cartilage, where it continues as the esophagus. Posteriorly, there is the prevertebral fascia. Okay, the prevertebral muscles fascia covering that prevertebral fascia. Anteriorly, it opens into the nasal cavity, oral cavity, as well as into the larynx. Okay, into the larynx. Laterally, it is related to the neurovascular structures in the neck and the styloid process and the muscle complex attached to that. So it is subdivided into nasopharynx, oropharynx, and laryngopharynx. Nasopharynx is the portion behind the nose. Oropharynx is the portion behind the oral cavity, and laryngopharynx lies behind the larynx. Okay, so what we are seeing is the nasopharynx, only this portion. This is the nasopharynx. So each of these, you have to define the boundaries and the features there. So here, if you see the nasopharynx, the roof is formed by the body of the sphenoid and the basilar part of occipital bone. Floor is formed by the soft palate and the pharyngeal isthmus. Anterior wall is the posterior nasal aperture and posterior wall is the anterior arch of C1 vertebrae. Laterally, it is the medial pterygoid plate of the sphenoid bone. Features here, if you see here, okay, so there is the pharyngeal opening of the auditory tube. Here near the roof, there is nasopharyngeal tonsil, which when enlarged, we call it as the adenoids. There is tubal elevation here formed because of the underlying tubal tonsil. Okay, so they are there. And behind this tubal tonsil here, there is a depression space here, which is called as the fossa of Rosenmuller. Oropharynx, the boundaries are the roof. Roof is formed by the soft palate and the pharyngeal isthmus. Floor is the posterior one third of the tongue and the interval between the tongue and the epiglottis. Anterior wall is the oropharyngeal isthmus and the pharyngeal part of the tongue. Posteriorly, it is body of C2 and C3, and lateral wall is formed by the pterygomandibular raphe, the mandible, tongue, and the hyoid bone. Features here, okay. In the lateral wall, we will see the palatine tonsil, and in the anterior wall, there is lingual tonsil, upper end of the epiglottis, median and lateral glossoepiglottic fold, okay, and epiglottic vallecula. That is, it's not seen. Okay. Laryngopharynx. Boundaries. Anterior wall, the laryngeal inlet is there. Posterior and posterior surface of the larynx. Okay, upper part, you will see the laryngeal inlet. Whereas in the lower part, it is the posterior surface of the larynx. Posterior wall is formed by the bodies of C3, C4, C5, and C6. Lateral wall is by the thyroid cartilage and thyrohyoid membrane. Features here, we have the cricoid and arytenoid cartilages, where we have the aryepiglottic fold, which forms the medial boundary of piriform fossa. And in the lateral part, we see the piriform fossa. Okay, piriform fossa is very important. Question commonly asked. So piriform fossa, medially it is bounded by the aryepiglottic fold and the quadrangular membrane of the larynx. Lateral part, it is the thyroid cartilage and the thyrohyoid membrane. Above, it is related to the lateral glossoepiglottic fold. Okay, then constrictor muscles. This is very important, the constrictor muscles of the pharynx. So we have three constrictors, superior, middle, and inferior. Now the superior constrictor, when we see from above, okay, near the medial pterygoid plate, from there it begins, okay. So it has the origin from the posterior border of the medial pterygoid plate, then the pterygoid hamulus, then the pterygomandibular raphe, and the posterior end of the mylohyoid line, as well as the posterior part of the tongue. It inserts into the pharyngeal tubercle. From there, there is a pharyngeal raphe which will be running downwards. So it gets inserted into the median fibrous raphe, that is the pharyngeal raphe. Nerve supply is by the pharyngeal branch of vagus nerve. Okay, through the pharyngeal plexus, it is supplied. And it helps in deglutition. Middle constrictor, it has the origin from the lower part of the stylohyoid ligament, as well as the lesser and greater corner of the hyoid bone. So insertion, it inserts into the median fibrous raphe. Nerve supply, pharyngeal branch of vagus nerve, and again helps in deglutition. Now inferior constrictor. Inferior constrictor muscle has got two parts, thyropharyngeus and the cricopharyngeus. The thyropharyngeus part, okay, it has the origin from the lamina of the thyroid cartilage, as well as the inferior tubercle and of the inferior tubercle, that is the inferior horn of the thyroid cartilage. Okay, so it gets inserted into the median raphe. So this is all supplied by the pharyngeal plexus and external laryngeal nerve. Cricopharyngeus muscle now. This has from the cricoid cartilage, that arch, okay, posterior arch of the cricoid cartilage, it has the origin. So this doesn't get inserted into the median raphe. There's a mistake there. So it doesn't get inserted into the median raphe. There what happens is cricopharyngeus muscle, it goes around, okay. So the right fibers and the left fibers, so they intermingle, the Dicker's set, okay. So it goes around. So there is a gap between the thyropharyngeus and the cricopharyngeus, and that is known as the Kinihan's dehiscence. So this cricopharyngeus is supplied by the recurrent laryngeal nerve. Okay. So then the longitudinal muscles. So the longitudinal muscles of the extrinsic, excuse me, muscles of the pharynx. We have three, the stylopharyngeus, the palatopharyngeus, excuse me, and the sulfingopharyngeus muscle. So the stylopharyngeus muscle, as the name says, comes from the styloid process. So styloid process, that is from the medial surface, okay, of the styloid process, it has the origin, and it gets inserted into the posterior border of the lamina of the thyroid cartilage. Excuse me. So nerve supply, stylopharyngeus, is by the glossopharyngeal nerve because it is derived from the third arch. Palatopharyngeus muscle has origin from the upper surface of the palatine aponeurosis. So this also gets inserted into the posterior border of the lamina of thyroid cartilage. So this is supplied by the cranial part of the accessory nerve through the pharyngeal plexus. Salpingopharyngeus, it comes origin from the cartilaginous part of the auditory tube and gets inserted in the posterior border of the lamina of thyroid cartilage, supplied by the cranial accessory nerve. Okay, so nerve supply here. Nerve supply of the pharynx, motor supply is mainly by the cranial root of accessory nerve, except for stylopharyngeus, which is supplied by glossopharyngeal. So all these exceptions you need to remember because they are asked as an MCQ question or in the Viva, you will have to answer that. The sensory, the nasopharynx, is by the pharyngeal branch from the pterygopalatine ganglion. The oropharynx is glossopharyngeal nerve, and the laryngopharynx is by the internal laryngeal nerve. What we mean by sensory is supplying the mucous membrane. Okay. The blood supply here is by the ascending pharyngeal artery, which is coming from the external carotid, ascending palatine and tonsillar artery coming from the facial artery, and greater palatine and pharyngeal artery from the maxillary, and lingual artery from the external carotid artery. Okay. Arterials, the venous drainage is drained into the pharyngeal plexus. Lymphatic drainage, it drains into the upper and lower deep cervical group of lymph nodes. Killian's dehiscence, this is what I told you. So you can see here, cricopharyngeus fibers are going circular, whereas thyropharyngeus, they are getting inserted into the median raphe. So what happens is, when thyropharyngeus contracts, right, cricopharyngeus relaxes. And when cricopharyngeus contracts, thyropharyngeus relaxes. So in that way, it helps in the deglutition. Okay. So basically, this will be acting like a sphincter. So sometimes if there is neuromuscular incoordination, what happens is this mucous membrane will bulge here outside. Okay, so that is known as the Zenker's diverticulum. So basically, Killian's dehiscence, it's a gap between the thyropharyngeus and cricopharyngeus. Okay, so normally it is present. The Killian's dehiscence is normally present. When there is neuromuscular incoordination, then what happens is this mucous membrane, what is seen there between the gap, that will bulge, okay, causing the Zenker's diverticulum. So enlargement. Okay, this is not related to Killian's dehiscence. Okay, so the nasopharyngeal tonsil, I told you earlier, when it enlarges, it forms the adenoids. Okay, adenoids, we see it in children. So adenoids are nothing but enlarged, inflamed nasopharyngeal tonsils. So there what happens is, since it is present in the roof of the nasopharynx, when it grows, what happens? It obstructs the airway. Okay, so they will be breathing more through the mouth. Waldeus ring. So Waldeus ring here, it is a collection of sub-epithelial lymphoid tissue in the form of the ring. Okay, so below the pharyngeal wall. So here, it basically belongs to the mucosa-associated lymphoid tissue. The internal Waldeus ring. Okay. So there is an external which is not a part of this, whereas internal, since it is below the mucous membrane, it is a former part of this. So internal Waldeus ring, okay. One is like, we have anteriorly, anterolaterally, posterolaterally, and posteriorly. So if you see, it will in this place. So anteriorly, we'll have lingual tonsil, anterolaterally palatine tonsil, then posterolaterally will be tubal tonsil. Okay, and at the roof, posteriorly will be the nasopharyngeal tonsil. Okay. So this internal Waldeus ring, it will drain the external Waldeus ring, which drains into the retromandibular group of lymph nodes. Okay, so you can see it. This is the lingual tonsil. This is palatine tonsil, here tubal tonsil, and behind will be the nasopharyngeal tonsil. Next, coming to palatine tonsil. Okay, so palatine tonsil occupies the tonsillar sinus or the fossa, okay, between the palatoglossal and palatopharyngeal fold. So the tonsil is almond shaped. It has two surfaces, medial and lateral, and two borders, anterior and posterior, two poles, upper pole and a lower pole. Now the medial surface here, okay, so medial surface, it is lined by the stratified squamous epithelium. And if you see here, there are crypts, 12 to 15 crypts. Okay, so the largest is called as this crypt is known as the intratonsillar cleft. So the lateral surface here, it is a sheath of fascia forming a hemicapsule of the tonsil. The capsule is extension of the pharyngobasilar fascia. So this surface, it is attached, okay, to the muscular wall of the pharynx formed by superior constrictor as well as the styloglossus. So tonsillar artery here, if you see, it enters the tonsil by piercing the superior constrictor just behind this attachment. So the palatine vein or external palatine vein, that is or paratonsillar, it's also called paratonsillar vein. So it descends from the palate in loose areolar tissue on the lateral surface of the capsule. It crosses the tonsil before piercing the wall of the pharynx. So vein may be injured during the removal of tonsil or tonsillectomy. Okay, so need to be careful of that. So bed of the tonsil is formed by from outward to in, if you see, the pharyngobasilar fascia, the superior constrictor and the palatopharyngeus muscle, and the buccopharyngeal fascia behind. In the lower part, there will be styloglossus as well as glossopharyngeal nerve too. Laterally, the facial artery with tonsillar and ascending palatine branches. Internal carotid artery is 2.5 centimeter posterolateral to the tonsil. Okay. Those are basically the relations. The anterior border here, it is formed by the palatoglossal arch with its muscle. The posterior border is formed by the palatopharyngeal arch with its muscle. The upper pole is related to soft palate and lower pole to the tongue. Then there is plica triangularis, which is a triangular vestigial fold of mucous membrane covering the antero-inferior part of the tonsil. Plica semilunaris, it's the semilunar fold which crosses the upper part of the tonsillar sinus. Then there is intratonsillar cleft. It is the largest crypt of the tonsil present in its upper part, okay, which represents internal opening of the second pharyngeal pouch. Then usually the peritonsillar abscess or quinsy, which is commonly called, it begins in this cleft. That is the intratonsillar. It is the largest crypt there. Okay. Arterial supply of tonsil. So the main artery is the tonsillar branch of facial artery. Other arteries supplying are ascending palatine branch of facial, dorsal lingual branches of lingual, then ascending pharyngeal branches of external carotid artery, and the greater palatine branch of maxillary artery. Since they also will be running in the same region there, okay, so they will give some tweaks to the tonsil. Venous drainage. So the veins, they pierce the superior constrictor and join the palatine pharyngeal or facial veins. Lymphatic drainage, lymphatics, they pass to the jugulo-digastric group of lymph nodes. There are no afferent lymphatics to the tonsil. The nerve supply is by the glossopharyngeal and lesser palatine nerves. Next is the pharyngotympanic tube. So pharyngotympanic tube is also called as the auditory tube or eustachian tube. So it is a trumpet shaped, so you can see this one. It's a trumpet shaped channel, connects the middle ear cavity with the nasopharynx. So it is about 4 centimeters and directed downwards, forwards and medially. It forms an angle of about 45 degrees with the sagittal plane and 30 degrees in the horizontal plane. This tube is divided into two parts. One is bony part and the cartilaginous part. So the bony part here, if you see, it forms the posterior and the lateral one-third of the tube. It is about 12 millimeters long and lies in the petrous part of the temporal bone near the tympanic plate. The lateral end here, okay, it forms, that is the anterior wall of the middle ear cavity. The medial end is attached to the cartilaginous part. Yeah. Okay, so this is the bony part, small. So relations here, superiorly, that is of the bony part. Superiorly, there is a canal for the tensor tympani. Medially, there is carotid canal. Okay. And laterally, chorda tympani, spine of the sphenoid, auriculotemporal nerve, and temporomandibular joint is present. Cartilaginous part. Okay, so cartilaginous part, it forms the anterior and medial two-thirds of the tube. Okay, so here if you see this anterior, this portion, medial portion is the cartilaginous part. So this is about 25 millimeters long and lies in the sulcus tubae. It's a groove between the greater wing of the sphenoid and the apex of the petrous part of temporal. It is made up of a triangular plate of cartilage from which forms superior and medial walls of the tubes. The lateral wall and the floor, they are completed by a fibrous membrane. Okay, the apex of the plate is attached to the medial end of the bony part. Base is free and forms the tubal elevation in nasopharynx. Relations. So relations anterolaterally, it is related to tensor villi palati muscle, mandibular nerve and its branches, the otic ganglion, chorda tympani, middle meningeal artery, and medial pterygoid plate. Posteromedially, it is related to petrous part temporal and levator villi palati. Levator, this muscle is attached to the inferior surface, and the salpingopharyngeus is attached to the lower part near the pharyngeal opening. Okay, this is salpingopharyngeus here. This is the levator villi palati muscle. This is the tensor palati muscle. This is the auditory tube. The blood supply is by the ascending pharyngeal and middle meningeal arteries and the artery of the pterygoid canal. Veins is basically the pharyngeal and pterygoid plexus of veins. Lymphatics, it drains into the retropharyngeal group of lymph nodes. Nerve supply here, the bony part, it is that ostium is that opening. Okay, that part, it is supplied by the pharyngeal branch of the pterygopalatine ganglion through the maxillary nerve. And cartilaginous part is by the nervus spinosus, branch of mandibular nerve, that is from the trunk it gives. Bony part, it is by the tympanic plexus formed by the glossopharyngeal nerve. So function is, it forms a communication between the middle ear cavity with the exterior, ensuring equal, and it ensures equal air pressure of both sides of the tympanic membrane. The tube is usually closed, opens during swallowing and yawning, and sneezing by the actions of tensor villi palati and levator villi palati muscles. Okay. Okay, so this question. Okay, 12-year-old boy complained of sore throat and earache. He had 102 temperature and difficulty in swallowing. He's a mouth breather. Okay. So difficulty in swallowing he had. Okay, so this is basically a case of sore throat he had, earache, so tonsillitis. Okay. The communication between the vestibule and the oral cavity proper. Okay, where it lies? It lies behind the third molar tooth. The joint between tooth and the gum. Okay, it is called as gomphosis. It is the first permanent tooth to erupt is the first molar. Most of the muscles of the soft palate are supplied by vagoaccessory complex except tensor villi palati. Okay, tensor villi palati by the mandibular, it is supplied. Okay. So with this, we finish today's classes. Okay, so thanks for watching Auricle. For more social content, you can follow the social media handles like YouTube, Instagram, Facebook, and Telegram. If you haven't yet downloaded the app, you can get it on Google Play and App Store and start your journey with Auricle. Until then, next time.